Good morning. Let's have a class, and we will go to talk about Staphylococcus and the Streptococcus. So this is important slides. We mentioned about using blood agar as a differentiated media for hemolytic, and we will mention that later on. So first of all is Streptococcus. So we want to talk about Streptococcus. Streptococcus, I use acronym, just use STREP. Okay, overall Streptococcus, this is gram-positive, coccale and chain shape. The chain could be long or could be short. So that's overall. Staphylococcus. I just write STAPHY. This is also gram-positive, coccale, but it is grape shape. So the morphology is different. There is one important biochemistry test we will talk about in the practice in the lab later on. It's a very easy way to differentiate Streptococcus and Staphylococcus. But we use it a lot because if you only base on the gram stain, it's hard to differentiate, hard to see, especially the clinical sample. So we use catalase test to differentiate Staphylococcus and Streptococcus. Streptococcus is negative and Staphylococcus is positive. So what is catalase test? Is hydrogen peroxide using catalase will be separated into water and oxygen. This oxygen will show in bubble on agar plates. But we said we will do this in the lab. This should never done on the blood agar, because blood agar is already have oxygen. Anyway, will cause bubbling. Okay, this is a very important test. So we mention here, we will do a conclusion table later on. We will mention that again. So let's talk about these one by one. So first pathogen, Streptococcus pneumoniae. And same as its species name. Streptococcus is a genus name. Pneumoniae is a species name. It will cause pneumonia. It is responsible for 80% CAP. So what this means, it's responsible for 80% community acquired pneumonia. It is very typical and severe in the United States. And the risk group is adult. And we will talk about the kids and the older people, okay? What are the symptoms? Cough, fever, and chest pain. And this is typical for adults. If it's for kids, it could cause a problem is otitis. What this means, you have buzzy, some kind of like a raining, buzzy, a little bit fuzzy feeling about it, and the ear pain. And also, it cause more severe is bacteria, semia, and septicemia. What this means, our bloodstream, our blood should be sterilized. You should not have any bacteria there and any pathogens there. If your bloodstream is contaminated with Streptococcus pneumoniae, it will cause a problem. It's called bacteremia and septicemia. Bacteremia is only colonization. Septicemia, not only colonization, also multiplication. Which means they're going to grow dramatically. You can understand it. That's a major risk, okay? That's for the kids. Older people, we mentioned earlier, if it's more than 40-year-old, what's going to happen, which is the symptoms of disease will have is pneumonia. Okay? And since we talk about the blood agar, what is that? This is alpha hemolytic, which means it is dark green colony represents incomplete hemolytic on blood agar. Okay, that's some basic information about ammonia. We want to talk about something more. We're going to dig a little bit more about that. In our real life, in our oral cavity, there are lots of streptococcus. It could be streptococcus, but it also could be Viridem strep. It's widely existing in our oral cavity. So, there is something we can do is differentiate. For example, Streptococcus bovis, Streptococcus mitis, mutans, and Streptococcus mitis. These are very tiny, but there's millions of Viridem streptococcus. If you just do a strip using a cotton swab, go to the teeth, or go to the oral cavity, you will find those streptococcus. And sometimes they bother you diagnose of Streptococcus pneumoniae, especially you do the cough, you get the sample, it's going to be messed up together. So how we do? Clinically, there is a very easy way to differentiate that is using blood agar. So on the blood agar, and we're going to add a disc. And this disc containing antimicrobials called opticam. And what they find, Streptococcus ammonium is very susceptible, which means very sensitive to the opticam. So this is transparent zone. And they find Viridem streptococcus is resistant. So you will see a smear growing there. This is Streptococcus, they say bovis, because of Viridem streptococcus. They resistant. And this is what we call S, and this is what we call R. And therefore later on, this opticam test we're using a lot, we call P-disc. And this is very important methods to differentiate Streptococcus pneumoniae and the Viridem streptococcus. Now, Viridem streptococcus, it could be just a normal bacteria in the oral cavity, but it also can cause a problem, which is, a story could be, you have a 70-year-old grandma, and then go to see a dental doctor, the dentist, and take out of the wisdom teeth or do some of the oral surgery, and after a couple of days she's died, because if the dental office did not do a good job of the dental hygiene, the Viridem streptococcus can be multiplication, and they could cause acute endocarditis, which is inflammation of heart valves. And that's a very severe symptom. If you failed dental hygiene, it is important. Okay, so that's very damaging streptococcus. Let's talk about something else. Streptococcus pneumoniae destroy host cells. Alveoli fluid with blood cell in the fluid. It's there's a heavy capsule. Now, there's one thing we forgot to mention. Streptococcus pneumoniae, we said, same as other streptococcus, it's gram-positive, it's coccell, it's chain, but it's very special chain shape and it's very short. It is two of them stacked together, packaged with capsule. And this is diprococcel. And this capsule is made by polysaccharides. It is anti-phagosome, which means could be anti the natural defense system of the body coming from the white blood cells. So it is very special. It looks like that. And we also call it long scent shape. That's a very special symptom. Of course, in the real life, when you see it, it's surrounded with red blood cell, white blood cell, but you see the diprococcel, it's very obvious, it looks like that. Looks like the picture. Now, we talk about diagnose, use X-ray, gram stem culture, antibiotic therapy, immunization. Now, Streptococcus pneumoniae, we do have a vaccine which is called PCV vaccine. We do have that one. This is coming from the polysaccharides. So if you go back to see the immune schedule here, that's pneumococcal, PCV vaccine. You do recommend it as a young kids and also the elderly people to took it. It's manufactured from the polysaccharides, the capsule, okay? This is where we talk about bacteremia, meningitis, conjunctivitis, sinusitis. We talk about that. And the capsule, we get it from the pneumococcal, we got it from the capsule. So this is something we want to say for the Streptococcus pneumoniae. And always remember the gram results, morphology, arrangement, and the catalyst test will be negative. It's community-acquired pneumonia. It will has all kinds of invasive things happen, especially for the kids. Okay, Klebsiella pneumonia. Klebsiella pneumonia. We will be talking briefly. Klebsiella pneumonia, although it says ammonia, this is only responsible for about 4% of the ammonia in the United States. In the US, it's not really a severe one for ammonia. This is mainly responsible for infant diarrhea and sometimes a little bit of urinary tract infection for the elderly people. This not really for ammonia. But this bacteria is very interesting. This is gram-negative, large-shaped bacteria. And it is lactose fermentation positive on Macanthi agar. Because when you see the picture there, what it looks like, it is on Macanthi agar, it is pink colony. So it looks like the color is very similar to E. coli, but there is a major difference. When you look at the colony, it's like a cheese, very sticky. We call it milk-coiled colony. Because of this milk-coiled colony, if the patient who get contaminated with clear ammonia, if has ammonia, they will do a productive cough, the sputum sample looks like currant jelly. It's brownish, purplish color. Currant jelly basically is using in the European countries. In the United States, we don't have that one often, so it's very similar to the grape jelly, like you're making the sandwiches for the lunch or for the breakfast. But it looks like that because milk of the colony. Now, where it comes from, very similar to Streptococcus pneumoniae, is from the heavy capsule. Okay? Let's see there, so. This is the one we want to briefly mention. And you can see the picture of what it looks like. Macanchiago looks like that. It's smear. So you take it out like a cheese. This is on the blood agar. White colony, sliced, looks beautiful like a cheese. Okay? It's very interesting. So Streptococcus pneumoniae, Veridine Streptococcus, and Klebsiella pneumoniae. So next one we want to talk about is Streptococcus pyogenes. So we move this one off. We're going to talk Streptococcus pyogenes. This is the one we mention often, and we have the slides talk about this already. Streptococcus pyogenes. Okay, Streptococcus pyogenes. This is a genus name, Streptococcus, everybody knows. Pyogenes, what the pyo means pus. That is dead, white blood cell. What is the genus means? That's genetic. Okay, that's Streptococcus pyogenes. Streptococcus pyogenes we call Group A strep. It will cause strep throat. Okay. This is the easy way. Everybody knows what's the story behind it. Lots of the textbook write GAS, and then you see GBS. What this means. This is the one created a great American clinical microbiologist, Rebecca Lansfield. 1895 to 1981. Pretty long life compared to the people in that area. This is in 1920s. He got all the streptococcus and then injected, we can say, infected into rabbits, which is experimental animals, and get the blood saline. And then you do serological typing based on precipitation, which is antibody-antigen reaction. And when they get this, they could differentiate different streptococcus. So he had Group A streptococcus, Streptococcus pyogenes, he had group B Streptococcus, Ag, Lachia, and he has group D Streptococcus, Enterococcus, Facilis. This is a major strep what we have. Here, obviously, we have a group A strep. That what Streptococcus pyogenes comes from, we call it GAS. Now, there is a question. Streptococcus pneumoniae, does this group belong into any of the Rebecca Lansfield group? It is not. Why? Remember we talked about, this is based on the serological typing, and they based on the cell membrane protein. They get from the rabbits and do the precipitation to isolate them. Streptococcus pneumoniae, there is no M protein in the cell membrane system, which is fluid mosaic model. So they cannot belong into any of the group. So we just write group Ni or Na. Just want to let you know. Okay? We want to explain this to you because lots of the textbook, they just put GAS, they just put GBS. It's kind of very confusing you. You don't know where that comes from. Clinically, it's used to group Streptococcus. Has been using for more than 150 years, or almost like 200 years. That's coming from Rebecca Lansfield. Okay? So something we want to introduce to you. Now, let's talk about this Streptococcus. Streptococcus pyogenes obviously have a strep throat. So what is a strep throat? Right here. Strep throat, you can see the picture right here. If open your mouth, you say, in the tonsil area, it's surrounded with a pseudomembrane system, you can say, under the pus. That's a strep throat. This is a risk group, is 5 to 50-year-old kids. It's a risk group. It's also accompanied with strawberry tongue. We'll be accompanied with that, okay? What happened is, when they have a strep throat, it is already in a developed invasive stage. It started on the skin surfaces. There is another risk group of people. If you have bites, cuts on the skin, or you have a chicken pox, blisters, these side of things also a risk group, because the infection is started from the skin surface. Not really, all of a sudden becomes strep throat. The skin surface is started with, we call impetigo. That means on the skin surfaces, you see dots, which is a lean, surrounded by a reddish area. That's called impetigo. That doesn't very severe, sometimes it hurts, sometimes it's a little bit itching. The second one, it will be penetrated a little bit, becomes cellulitis. What this looks like, the cellulitis, is underneath the skin surface. You see everything looks like that. We call it a bee or horn house. Like a bee house. That's called cellulitis. So this is developed then they become strep throat. Now there's one of the bad thing happens is, people with strep throat, you use antibiotics, even they recovered, they still have some of what we call sequela, okay? Which means the disease you post-streptococcal. When you have a sequela, what you have is rheumatic fever and glomerular nephritis. Glomerular nephritis. So rheumatic fever basically is you have a fever with joint pain. So you have a fever, you have a joint pain here, and glomerular nephritis is kidney dysfunction of filtration system. So what happened is, you have glomerular nephritis, you will see the urine sample have protein, have glucose has been tested because the filtration system has been damaged by that. So that something is quite severe with streptococcus. Okay, so that's what we have, and also it's accompanied with some others like tonsillitis, pharyngitis. That could be also the sided symptoms, but major you see from empathygocellulitis, strep throat with sequela. We have a rheumatic fever and glomerular nephritis. So that's very interesting. And this pathogen, we already talked about, it is very invasive because the whole thing beta hemolytic. It is important information because on the blood agar it is transparent zone. Okay, now we want to say something. Streptococcus pyogenes is group A streptococcus. How about group B streptococcus? Group B streptococcus is the one relatively is for pregnant women. That is a risk group. They all looks very similar. It's all strep. But theological typing, we call it a GBS. It is Streptococcus agalactia. This is the one is very important for pregnant women at 35 to 37 weeks. You need to do a screen test whether you have GBS. If you have a GBS, you need to use antibiotics immediately based on the OB's suggestion, because otherwise the newborn could have ammonia, septicemia, and meningitis. This is the reason why meningitis in the newborn, 0 to 2 months, is GBS. That's the reason. It's coming from the mother. Okay? This is important. It could be transferred directly to person. We mentioned about here, but the vagina may be the source for the newborns. It's a risk. Now, same thing. You have GBS and GAS. How we differentiate it? We differentiated the Streptococcus pneumoniae and the Viridam streptococcus. How are we going to differentiate GAS, Streptococcus pyogenes, and the Streptococcus agalactia? The same thing here. We're going to using is a disc. This instead of you have a basic trace, you have an opticand, we have basic tracing. So we call this as A disk. Now the results is also very interesting. If you have Streptococcus pyogenes, it is a transparent zone, which means it is completely susceptible. And if you have GBS, which means Streptococcus agalactiae, it is surrounded, growing very well, and showing you a big mass area there. This is resistant. Okay? It's very interesting results for that. Now, what we do the prevention, I don't think there's a vaccine for that. You have to do a detect permanent carriers and using antibiotics immediately. There is no way you just to do some of the vaccine for that. Okay. So this is what we talk about. Staphylococcus. These slides are already talked. Okay, we're going to do another conclusion table later. If we don't have time, we can do next week Tuesday. Staphylococcus, gram-positive coccell, grape shape. It's catalase test positive. It could be in our normal skin surfaces. Is that right? We mentioned lots of times, Staphylococcus can grow on the skin surface because it's kind of like a halovirus. In the mannitol salt agar, it will grow, and we will mention that. For Staphylococcus, we will mention those three things. So, Staphylococcus aureus, we mentioned a little bit more, others we'll mention briefly. So the first one is Staphylococcus. When you look at the slides, the first one, epidermis. Epidermis. Okay, when you see the genus name, epidermis, it means it's on the surface. So this is the one, usually we say it's a normal bacteria on skin surface. However, if in the hospital they failed routinely sanitation standard operation procedures, or the hygienic process is failed, that could be cause contamination. Okay, that's called a nosocomial infection. We will mention this real quick. But basically, we say it's a normal bacteria on the skin surface, Staphylococcus epidermis. That's the first one. Second one, Staphylococcus saprophyticus. This bacteria, we give them a nickname. We call it a honeymoon bacteria. So what happened? This is usually for sexual activity women, sexual activity girl around 20 to 28 years old. Then the sexual active woman have that contaminated from the vagina tract, and they accompanied with a very typical abdominal pain and with UTI, which is urinary tract infection. So the nickname is called the honeymoon bacteria. So they often have a joke. We made that joke a long time ago. So there's a young lady who is like 19 years old, and one day he told her mom, he said, I have the abdominal pain, I have a little bit of bleeding, and in the long period of time, and then the doctor, they're going to see the doctor, the nurse, and the nurse do some of the quick test. He will find it out, said, your daughter have Staphylococcus saprophyticus. We call it a honeymoon bacteria. Then the mom will say the girl has not been at home for a couple of nights. That could be happening. Now, then the question is, why the doctor or the nurse could be find this pathogen very soon? Why they say it is Staphylococcus saprophyticus? Why it is not epidermis? Why it is not the Staphylococcus aureus? Because, indifferent from the other Staphylococcus, this one is resistant to low dose of novel Bowsy. It is very typical to using in the hospital to do a quick test. Okay, so and the others, they are relatively susceptible and sensitive to the low dose of novel Bowsy. So that makes it a very special. But just want to let you know, sexual activity in women 20, 28 years old, accompanied with abdominal pain and UTI. That's Staphylococcus saprophyticus. Now we want to talk about the Staphylococcus aureus. This is the one we already talked about. And you did the observation in the first lab. As I said, we're going to practice using microscope, and we use a made glass slides. I said it's expensive, $5, $6 one piece. That is Staphylococcus aureus. But we haven't talked about detail. We want to talk about three things. Number one is food intoxication. So Staphylococcus aureus is very easy to contaminate. One kind of the food is chicken salads. Chicken salads, you can get it from anywhere. It's sometimes very cheaper. It's like $2, $3, $5 with coupon. But it's a big risk for Staphylococcus aureus. The reason is, especially in the winter season or fall season, when the people prepare, then they're sneezing. Is that right? They're coughing, sneezing. They do like this, they do like that. And then they prepare the salads. With chicken, with salads, it's a very good bacterial medium to growing Staphylococcus aureus. And if you take some of infected chicken salads, you get a food intoxication, you have a vomiting, diarrhea, nausea as soon as 6 hours. Real quick. So that's food intoxication for the chicken salads. It's Staphylococcus aureus. The second one, what I want to talk about is, we call it a MRSA. You heard about this. I believe lots of you heard about this. This is called methicillin resistant Staphylococcus aureus. This is caused by people using methicillin way too much. Methicillin is an advanced developed of penicillin. We have a penicillin, G, amoxicillin, and the methicillin is later on to prevent. They will be digested using the stomach acids, and also kind of a broad-based antibiotics. But methicillin using too much. So become methicillin-resistant Staphylococcus aureus. And more of them is because of the carelessness in the hospital, and we call it a nosocomial infection. So this is basically hospital-acquired infection. So, hospital-acquired infection. That's for MRSA. Okay, it's a severe one. You can't go anywhere. You hear about that. And then what you see, some mild symptoms could be happen. You will see is on the skin surfaces is kind of like Staphylococcus lesions. It could happen for the babies, for the young kids. Because of reasons, there is a coagulus. Okay, the pathogen has coagulus. The coagulus will cause blood clotting. So what happened is, we can do some experiment in the lab using rabbit blood serum and it's a very white, it's a transparent liquid. Then we add coagulants. We can inoculate it with Staphylococcus aureus, do a comparison. You find that you add Staphylococcus aureus, you add coagulase, looks the same. The tube, you flip it, it's completely glued. It cannot be fall down, the liquid, because of the coagulase. Okay, so that's a coagulase positive bacteria. And that will cause about that. But more severe things will happen is this guy, is T, toxic shock syndrome. This is what happened in 1970s. People use highly absorbent tampon in the period of time. This Riley brand in 1970 killed about 13 people, 30 women who used this highly absorbent tampon in the period of time. So the story is that if you use a highly absorbent tampon, absorbed all the liquid, the moisture is gone. Now what happened in the vagina tract, if the moisture is gone, the normal bacteria will be killed, especially like beneficial bacteria, some lactobacillus will be gone. Then Staphylococcus aureus started to dominate there, and then will generate a toxin. And the toxin will cause a shock. And what type of the toxin shock will generate? Let's say this is a liver, let's say, or a kidney. Okay, normal, there is a blood is going there very smoothly, give them energy, give them oxygen. If you have a toxin there, what happens? This is not going to be enough, because you cause a lower blood pressure. So not enough blood is going to these organs, and this will cause a severe acute decay without these. And we will have a shock, people will have. We have a coma. So that's toxic shock syndrome. Okay, so that's coming from a 1970s, from this horrible tampon, and this company is out of the business after that, after the major recall. And you can search online, the Riley tampon, there's a big outbreak happens before. And then people never use that anymore. Okay? So these are the stories which is about that, and this is interesting, the Staphylococcus aureus, the methicillin-resistant Staphylococcus aureus. Regarding to the beta-lactam antibiotics, we will talk about that later. So, we finished about here. We have one thing I haven't mentioned is group D streptococcus. This is Enterococcus facilis. We haven't mentioned about that one. Enterococcus facilis, although it is called Enterococcus, but a long time ago it's belonging to Streptococcus, and later on it's separated. This guy basically is called UTI, infant diarrhea, very similar to Klebsiella pneumonia. And this guy is very interesting. They are resistant to up to 6.5% salt. And this guy could grow on a very interesting agar is bile-esculin agar. And bile-esculin has bile salt. It is an antibiotics reagent, so it's a selective media. And esculin, they could reduce to esculitine. So when they grow on the esculin agar, become esculitine, what happened? It turns black colony. So this is an agar play is very interesting using bile-esculin agar. Now later on, people find another species, Enterococcus faecium. This is one, instead of a human pathogen, people find they showed more resistant to antibiotics, to thermal inactivation, compared to Salmonella. So it became a surrogate bacteria for Salmonella. And in my lab, we tested a lot, use Enterococcus faecium as a surrogate to see the antibiotic inactivation behavior and the thermal inactivation behavior compared to the salmonella. And I will talk about a little bit later on when we go to the poultry decontamination section in our exam form. Okay, so it's very interesting, this passage we talk about these things. Okay, so Streptococcus and Staphylococcus, each individual we talked about. But we said we're going to do a conclusion. So the conclusion table I'm going to draw here. Before we end up this section, it is very important for you to have a big picture in your mind to talk about all these things. And it will be a study guideline. I think it's a very good study guideline, like a blueprint on your mind, then how these things are connected together. Because we talk about different Streptococcus and also different Staphylococcus. So we will start with a very big picture. Yes, we have Streptococcus versus Staphylococcus. Okay, the first thing what we do is we do a catalase test. If the catalase test is negative, no bubble, it could be Streptococcus. If the catalase test is positive, which means it's bubbling, we say it is Staphylococcus. Okay, what's a Streptococcus we talk about? We talk about alpha hemolytic. What are the two things we talk about? Streptococcus ammonium and the Viridine Streptococcus. And how we differentiate that? Remember, we're using P disc. The components of the P disc is opticam. And what we find, Streptococcus ammonium is susceptible, Viridine Streptococcus is resistant. It looks like that. So that's alpha hemolytic. Okay, beta hemolytic. What are the two Streptococcus we talk about? Is Streptococcus pyogenes and Streptococcus agalactiae. And we talk about the Rebecca Lansfield group, so this is GAS and this is GBS. What is the difference? What's how to separate them? Same thing. This time around, we are using A disc. And the components of the A disc is bacitracin. We will mention bacitracin one more time when we talk about the antibiotics. The mechanism is interesting. Streptococcus pyogenes is susceptible. Transparent zone. In contrast, Streptococcus agalactiae is growing surrounded the disc and it is right resistant, is all. So beta hemolytic. How about gamma hemolytic? Which means nothing happens. Well, that's Enterococcus facilis. And we say this is resistant to 6.5% bile curing and turns black colony. Okay, so this is what we have is for Streptococcus. Now Staphylococcus, what we have epidermis. So we talk about Staphylococcus epidermis. We talk about Staphylococcus saprophyticus. We talk about the Staphylococcus aureus. Now, how we differentiate that? First thing first, how they grow on mantle salt agar. And you will see it's very interesting. They all grow because they all Staphylococcus, but the different colony color. Staphylococcus epidermis is colorless. Saprophyticus is colorless, but aureus is yellow because mantle fermentation positive. And then the second one, let's grow them on the blood agar. What are you going to see? It's very interesting. Staphylococcus epidermis is gamma hemolytic. Saprophyticus also gamma hemolytic. How about aureus? Beta hemolytic. Otherwise, it will not cause toxic shock syndrome. Okay, it's very interesting. Now, coagulase test. We mentioned about the coagulase test. Which one is positive? Staphylococcus aureus is positive. These two are negative. And we said that this is, we got it down in a rabbit plasma saline. And we find that this is completely glued. You flip it over, it's completely glued, and these two is false. That's coagulase test. Last one, remember the joke, honeymoon bacteria? It's novel biosyn. Of course, it's a low dose, low level. We find Staphylococcus epidermis is susceptible. Staphylococcus aureus is also susceptible, but this guy is resistant. That's why the nurse and the doctor could find this one very easy. And this is a very interesting table when you are going to be combined with everything here, when we talk about the Staphylococcus and we talk about the Streptococcus. Okay, so that's a table what you should be remember all the time. And I also want to show you here, this is the Staphylococcus. Look at this tedious table. How many of the enzymes it has? It has beta-lactamase, break down penicillin. Penicillin is beta-lactam. There's a lactam rings there, and very specific. And we also call it penicillin. Penicillin activated enzyme has different things about that. We'll talk about this. Catalase it has. Converts hydrogen peroxide into odd water and oxygen. Coagulase. You can see it's a long word there, cause fibrin clot. DNase, which is destroy DNA. Enterotoxin. Remember we talk about endotoxin and enterotoxin. For these things happen, Staphylococcus aureus, remember chicken salads? We talked just a second ago. Chicken salads, this is enterotoxin. This is different from endotoxin. What's the difference from that? Endotoxin, you basically heated it. You can kill it. Enterotoxin is always there. This is heat liable, and this is heat resistant. There's a major difference about that. So, we have a two different scenario where it comes out, a two new concept, endotoxin. This is we call food infection. And exotoxin is food intoxication. exotoxin, is food intoxication. So this is here we can say enterotoxin, sorry. Enterotoxin and endotoxin, the difference between them. Okay, hemolysin. This is alpha hemolysin, beta hemolysin is combined. Then hyaluronidase, dinase, is spread factors. Then you have a penton, valentine, leukocidin. When you see the leukocidin, most of the time it's going to destroy the white blood cell. Then lipase, it's break down lipids. Nucleus, break down nucleic acids. Protein A, antifungal. Protease, break down proteins. And you also going to see the last one here, toxic shock syndrome, we mentioned, associated with fever, shock, multisystem environment, the toxic shock syndrome. So you can see a simple Staphylococcus aureus is how many toxins there, how many enzymes there, it's a huge. That's why in the lab we cannot use it. We're going to use Citrobacter or Lactobacillus as a demonstration and a surrogate bacteria for Staphylococcus. It's very invasive. And ironically, if you eat the chicken salads, you get a vomiting diarrhea with Staphylococcus aureus, you don't have to report to CDC. But if you eat an undercooked hamburger, you got contaminated with E. coli 0157H7, you have to report to CDC. Because E. coli 0157H7 historically have a death happens, Staphylococcus aureus also it happens, but nobody cares. So that's something we will talk about later, okay? So that's all we have here. And I will be put kind of the after class reading material with all the passages we already talked on the eCampus, and you can read. Next week, Tuesday, we're going to spend in the class, talk about the big topic, which is Clostridium. There's 4 different kinds of the Clostridium we're going to talk about it. Okay?